let's say you are 64 and you already have Parkinson's or you're undergoing cancer treatments, you have rheumatoid arthritis, expensive conditions. A lot of people are nervous when they're getting ready to turn 65 because they think they might have to pay more, not true, or they might not be able to get approved, also not true. When you first enroll in Medicare, they cannot ask you any health questions. So they will have to take you and they can't charge you more because you have Parkinson's or rheumatoid arthritis. I like to call it the golden ticket because down the road later, if you try to switch plans, that's when there's a barrier if you're sick and you might never be able to switch plans. So it's important when you're approaching Medicare that you understand this. If you're approaching Medicare and you're already sick, you already are doctoring for some severe illnesses, which way should you go? Should you go with a Medicare supplement? Should you go with Medicare Advantage? You should go with Medicare supplement. Medicare supplement costs more. But especially if you are taking some Part B as in boy drugs, which you might very well be if you have rheumatoid arthritis, osteoporosis, multiple sclerosis, cancer, Parkinson's. Those drugs are very expensive and they're not covered under your drug insurance, Medicare Part D. But they are covered under your Medicare supplement. So if you have a Medicare supplement, you'll have an annual deductible. This year it's only $240. After you've paid that $240, if you're taking a $10,000 chemotherapy drug, you're not paying for it on a Medicare supplement. But if you went with Medicare Advantage, you'd be paying 20% of the cost of that drug up to your policy's maximum. And that varies. That's all over the board. That could be $6,000, $7,000, $8,000, $9,000 that you would be out of pocket if you went with Medicare Advantage versus if you went with a Medicare supplement. But you're saying, but a Medicare Advantage had a zero premium. That was attractive versus a $200 a month premium. So you can do the math here. You're going to come out ahead financially on the Medicare supplement side. Now, this is easy if you're already sick and you're approaching Medicare. Most people that are approaching Medicare at 65, they're healthy. They don't have anything yet. So about half the people choose to go with Medicare Advantage. They choose to gamble. I hope I stay healthy. I'm going to try to stay healthy. And I'm going to go with this very low premium plan. And I understand there's a risk out there. If some of these things happen, then I would have to pay more out of pocket. About half the people go that way. The other half the people, 30 million people, are going with a Medicare supplement. They're saying, I'm not sick yet, but if I do get sick, I'd feel more comfortable being over here where the costs are contained. And I know I'll never pay more on a Medicare supplement plan G than my annual deductible. Like I said, this year it's only $240. That deductible does go up every year. It's tied to inflation, so you can project it's going to go up $10 to $15 a year. But still, that's a very low deductible. But the other factor on a Medicare supplement is your monthly premium versus Medicare Advantage where it might be 0, 10, 15, 20, low monthly premium. Medicare Advantage can start higher, could start a female 65 in Oregon might be almost $250. In the middle of the country might be $150. In New York might be $350. So wide variance of price based on your actual location. Wherever you start on your Medicare supplement, there's one thing you can take to the bank. It will go up. It will go up each and every year. It's tied to medical inflation. So medical inflation is never going to stop. Your Medicare supplement is never going to stop going up. So as much as you might buy your Medicare supplement and you feel very happy and safe and you're comfortable with the price because of what it gives you, that protection, with all those rate increases, if you get 10% rate increase a year, which is a bad rate increase, but kind of what we're forecasting for next year, how many years can you take a 10% rate increase before you said, the math no longer works here? If that happens, you always have the opportunity to move to Medicare Advantage. Again, they can't say we won't accept you because of your health. They have to take everyone at every year, not just when you first go into Medicare, but only for most people, only during the end of the year, what we call the annual election period, October 15th through December 7th. So if you're in that position where you're like, oh, my Medicare supplement is just too expensive, it's not comfortable, you can move to Medicare Advantage this AEP. Hope you learned something today. Thanks for watching. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week.
Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.